funny, the woman at the desk, her name was Rebecca, and she told me her name was Rebecca. And then when I went to sign in, her name was Campbell. Her last name was Campbell, so there was 2 people I met together in my name. That's funny. Wow, it's 1 o'clock. Unusual, I've got to be on time.
Hello there, Rebecca.
Hello.
Hi, I'm Dr. Ball. I work with Dr. White.
Hi.
How are you doing today?
Good, thank you.
Good, good. So I was reviewing your chart and just kind of getting caught up. I guess you met Dr. White last year, late
Yeah.
last year. Yeah. You guys had talked about kind of the findings in your pelvis and this likely fibroid growth on your uterus.
Well, I don't know what she said she didn't know what it was to me, that nobody would know until it was removed. But my and she wanted to have an MRI done, which I have, and blood work. And yeah, I just wanted to go over again what the procedure would be,
Right.
and I want my ovaries to be left.
Right.
Would that be the case?
Right. Well, let's back up a few steps here. So, the concern when somebody comes in with a growth in their pelvis, in the gynecologic organs, is, Dr. White's right. We don't know what it is until it's under the microscope. But when it arises off the uterus, one of the things it could be is a fibroid, which is a benign process. Some of the fibroids look a bit angry on imaging, which is partly why you were sent to us for an opinion and she saw you. So in the interest of safety, she wanted to remove it for you at that time, but as a compromise, you wanting to kind of put off surgery or think more about it, she repeated the MRI. The reassuring thing about the MRI is that it really doesn't show much change from previous, which in our business we take as a win, because if this was a nasty cancer of some sort, for example, then it likely would have changed and grown and looked a lot different, especially because it's been quite a few months in between. So that's quite reassuring, and that makes it even more likely that this is simply a fibroid.
Okay, so it'd be best just to leave it and not have an operation.
Well, I can never say with 100% certainty that that's absolutely going to be the best option, the only option. But I'm much more reassured seeing this MRI.
Okay. Does that mean it will slowly dissipate then?
Well, when people with fibroids hit menopause and their estrogen goes down, their fibroids usually start regressing. Now you're 48. Are you feeling any symptoms of menopause? Any hot flashes?
I do occasionally have hot flashes. I barely have had what you could call a period, a few drops of blood, maybe once a year, twice a year. That's been the same for the last couple of years.
Okay, so certainly it sounds like you're at least what we call perimenopausal. So you're not kind of officially fully in menopause, but you're getting there. So, the average age of menopause being around 51, you're in that window. It likely will be that over the next few years, as your estrogen level drops, that this will start to regress a bit.
Okay, that's good. Yeah, because I'd rather not have an operation.
I hear you. Yeah. The other thing that could be considered, I understand you're having some urinary symptoms.
What do you mean?
Well, these fibers, these growths can often push on the bladder and the rectum, and
Yeah.
Shannon was saying that you have some bladder.
Yeah, I
growths.
don't have very much time, like very much room.
Mhm.
If I have like a big mug of tea, then I need to go to the toilet many times.
Yeah.
To so I get it all out of my bladder.
Right.
And with the other side, if I need to go to the toilet, then I have to get there quickly because I don't have very long, and I've had a few accidents.
So something to consider, you certainly don't have to do this, and you don't even have to decide today, is there is a procedure that can sometimes be done to help shrink the size of a fibroid, and that's called a uterine fibroid embolization. So, this would be something that you could explore in order to help alleviate those symptoms with your bowel and bladder. If we could shrink that down, it probably cause less irritation.
Yeah.
So the fibroid embolization is a procedure that's done, you're sedated, frozen, there's a needle that goes in through the groin, wraps around, there's a little tube that wraps around and into the blood vessel that feeds the uterus, and then that blood vessel is blocked off so that it shrinks the blood supply to the fibroid, and then the fibroid shrinks.
Okay, yeah.
Because if you cut off the blood supply, then obviously it's not right. So, if you wanted to explore something like that, I could send you for an opinion.
Yes, please.
Okay, well, that's good.
Yeah.
So the interventional radiologists are the people that do those. So they're radiologists that do procedures under image guidance. So you'd be in the radiology suite, and they would stick a tube in with the needle, and they would get it done there. It can be
through my work, uterus.
So they put a tiny little tube in through the groin vessel, and which tracks up down into the uterine vessel, and then they find the dominant vessel off the uterine artery that is feeding the fibroid. And then basically what they do is they clog off that blood vessel so that it blocks off the blood supply to the fibroid.
So am I semi-knocked out while this happens?
Yes, absolutely. Yeah.
But am I half awake? Am I aware?
You know what? I'm going to have to defer to them as to how much sedation they give you. I'm not sure because I don't do those procedures.
Okay.
So
I'm just curious.
Yeah, I suspect you'll be quite comfortable if not asleep, but I can't say for sure. They certainly need you to be comfortable enough to be still for it. So I'm pretty sure.
Yeah. Well, I had my teeth out, two wisdom teeth out, and they gave me what was it called? It was in England. It wasn't a full, I can't remember what they called it, but they put it through my veins. They had a sedating guy, I can't even think the proper anaesthetist. But I was aware that they were rummaging, and I got up, and I knew
it'll probably be something similar.
Yeah, I was kind of I'm a good patient. I don't freak out, but kind of.
Good. So with this, the success rate isn't always 100%, but often they can achieve, 30 to 50% shrinkage over several weeks. It takes several weeks to kind of kick in.
Yeah.
It can be a bit painful, all right, because essentially they're cutting off blood supply to tissue. The tissue's dying, and when tissue dies, it's painful. But
they're giving me painkillers.
Yeah. For a lot of people, ibuprofen and anti-inflammatories are sufficient, but they'll go through all of that with you.
Yeah.
So what I should do today, I should examine you, make sure there's no red flags, make sure there's nothing that's kind of standing out that make me more worried about this plan. Okay. And then we can go that route.
Yeah. Okay.
Sound good?
Yep.
Okay. All right. So come on, lay down the bed right to this break in the bed. You're down here. So you say you just have an bleeding once in a while?
Well, I wouldn't even call it that. It's like spots.
Okay. So not a regular period for sure.
Yeah.
Okay. All right.
But I have come on.
Good.
But I like the idea of it shrinking it because it's quite big.
Yeah, it is a good size, and no wonder you're having pressure on your bladder.
Yeah, it's constant pressure.
Yeah. Do you ever take painkillers for it?
Yeah.
Okay, just relax your head back, and then it relaxes your muscles here, and then I can feel. Yeah, it feels a bit full in there. It's a decent size. Yeah. Okay, so I'm just gonna have a quick look and a feel. Okay. Yeah. Oh, there you go. Okay. Move up to the side here, just a little bit more for me, okay? There you go, no pressure. All right, where are you over here? Just gonna do an internal exam now, okay?
It does hurt, you know, when you do that. When what you just did hurts. So
Yes,
just
I know that, which is why I try to be quick
If
and
it's not
gentle.
necessary to do anything there, could you not do it?
Okay, so
I'm just gonna fix the
report
bed.
that you declined exam, that's okay. You have every right to decline exam.
I'm just gonna bring your legs over. Just be careful on the bed.
Okay, so I'm gonna send you for an opinion regarding embolization, okay? And then I'll book you back to see Dr. White a few weeks after that and kind of see how things are at that time, okay?
Take care.